I'm Dr. C Gupta, Chief of Vascular Surgery, Interventional Radiology and Podiatric Surgery at Care Hospital in Banjara Hills, Hyderabad. We are a team of vascular specialists providing comprehensive care under one roof for patients with any vascular disease. With me is Dr. Rahul Agarwal, my colleague and a consultant vascular surgeon. And today we are going to discuss a topic which is not only hot but has been constantly burning for the last many years. Because we get patients diagnosing themselves and coming to the outpatient thinking they have a very dangerous disease. Varicose veins. I'm sure most of you would have heard that because there is so much of online material available about varicose veins. So Dr. Rahul, the first question I would like to ask you is there a difference between varicose veins which may require treatment or varicose veins which are only cosmetic?
A very important question. I think most of the patients note some kind of spider veins or very small veins on their legs, and they come to us asking, sir, I've got varicose veins and I've got leg pains as well. Now, leg pain, they relate to those small veins which are very innocent. Those veins may not be actually a part of the actual varicose veins problem, which we say that there should be a reverse flow in the veins. When there is a reflux, when the pumping is not happening properly, the blood is not traveling from the legs to the heart properly. It's not traveling back. So there is a problem in the valves where there is reflux, and whenever the patient is walking, there is reverse flow in the veins. That is not there in those patients with spider veins usually. So that is one category of patients who say they have spider veins, but the deeper veins or the superficial system in which the actual reversal should happen is not there.
So I think we need to clarify what really varicose veins are and what is the normal flow. But just to finish off on spider veins, many of you will have spider veins, almost 40 to 50% or even higher percentage of population has those tiny spidery things on the legs and the thighs, and sometimes they're quite extensive and appear a little scary, especially after you watched a YouTube video which sort of pushes you towards getting a surgery done, that this might cause this or that. So we see patients who have these spider veins and osteoarthritis, and they think the knee pain is because of veins. The poor things get blamed because they are visible. They just happen to be there. So now moving back to the real varicose veins.
So the second category of patient, the real varicose veins. Now these patients may or may not have the spider veins at all. So these patients will actually, the problem or the pathology, what we call, is the reversal of flow in their veins.
So normally blood will go from the legs towards the heart. In these patients, there is a reversal
flow.
So that will sort of increase the
venous pressure in the veins.
Okay.
So that increases the pressure in the legs, in those veins. Gradually, because of that, they have that aching symptoms or the dull aching pain, which they experience when they are standing for a longer time.
And as the pressure increases, some of these veins become bigger.
Yes.
What we call the real varicose veins, which are visible on the leg and sometimes on the thighs. And for some patients, they develop actually even more symptoms. Can you tell us about those?
Yes. So as the pressure increases, there is some leakage from those smaller venules that leads to the pigmentation in the skin. Now that pigmentation is like a tattoo, and that is happening from inside out. So as the pigmentation happens, the skin becomes unhealthy and it becomes more brittle. It gives away and breaks. That leads to formation of ulcers. That is called as venous ulcers.
So varicose veins can be just visible or asymptomatic. They can cause dull ache or pain. They can cause pigmentation, as Dr. Rahul said, or even ulcer formation, and occasionally spontaneous bleeding, which is quite painless. You are standing taking a shower, and suddenly you find there is a small pool of blood around your foot. That can also happen in varicose veins.
Yes.
So how do we decide, or what investigations do we do to decide, okay, this patient will benefit from intervention?
A simple Doppler scanning of the veins will help us to identify what are the veins, which veins are affected, and at what level they have the reversal of flow in them.
So a color Doppler or a duplex scan done in the standing or at least sitting position will help us identify which veins have that reversal of flow, and patients may actually benefit from intervention.
Yes.
What are the interventions available to us to help patients who have symptomatic varicose veins?
So with the advanced technology, we have got many endovascular procedures like RF ablation, laser ablation, glue therapy. These are the three commonly used ablation methods for the varicose veins. Now in this, what we all commonly do is the laser ablation. It has got the least complications in a good hands. We take utmost precautions that any kind of complication does not happen. So the rate of complication is very less. It's a daycare procedure. It is painless, and the patient can go to work the next day.
Yeah, in fact, most of our patients are walking within 30 minutes of procedure because we do all of these under local anesthesia.
Yes.
Now, do you think the advent of these procedures has made a difference to how these patients are treated in terms of their convenience, their comfort?
So absolutely. Long ago, these varicose vein surgery was done through an open method where there was a large scar. Patient had to undergo either general or spinal anesthesia, and the recovery time used to take almost 5 to 7 days just to walk properly. And going back to their work would have taken them 2 to 3 weeks. Now it's a matter of 30 minutes procedure, 30 minutes after you can walk, and the next day you can go to work.
Very true. I think these minimally invasive procedures have made a huge difference to patient outcomes, their comfort. There is also a flip side to it. Now, since these procedures have become easy to perform, now it is not only vascular surgeons who do these procedures, we have a lot of people doing these procedures. And it's sad, but the truth is that a lot of patients undergo these procedures even when they do not have varicose veins.
Yes, absolutely.
In fact, I tell my colleagues in many of these centers, the only indication for doing a varicose vein surgery, I won't say varicose vein surgery, a laser ablation or a glue therapy, is a patient walking in with a leg. Veins are not really necessary. So that is the problem with therapies when they become easier. Anyone and everyone can do it, and obviously there is scope for doing procedures when they are not indicated.
Yes, definitely. I would like to add to it that when I was a general surgeon, the understanding of a disease pathology was not that great, because it has become a specialized disease where a vascular surgeon who spent years understanding the disease and treating it, they are well aware of the reasons, the techniques, as well as managing their complications. So a vascular surgeon, when treating a varicose veins, is able to understand the pathology and the patient as a holistic.
And when these procedures are not performed correctly, either not performed for patients who have varicose veins or performed inadequately, these patients tend to have poorer outcomes. And it's the procedure which gets blamed, because so many patients who come to us, they say, oh, if I get this done, it will come back very soon. My uncle got this done, my cousin got this done, and it came back within 1 year or 6 months. Ulcer was there, it never healed. Now, these are situations where probably the patient assessment was not adequate, not correct. So correctly assessed, we know what to expect from the surgery, and the patients also have a realistic expectation from what they will get once we do an intervention. What would you say about a patient who is obese, let's say a BMI of 40, 45 comes with pigmentation on the leg, maybe ulceration or even bleeding from tiny varices. Do all these patients require laser ablation?
Oh, absolutely not. If I see 10 patients who are obese, 9 of them will not have varicose veins. They are just obese, and because of the obesity, there is increase in the venous pressure, which is transmitted, and they actually present with all the symptoms of varicose veins. Now that tiny vein which is actually doing the correct job and it's ablated and operated on it, the symptoms and the problem of that patient is going to worsen.
Correct. So this is another group of patients that we get to see who are obese, who never had reversal of flow, which means they never had varicose veins. They undergo laser or glue ablation of the main veins and they come back with worsening of symptoms. So in fact, I often talk about a police officer whom I used to see in Vizag, and I'm sure he will listen to this too, who came to me with leg pain, and I examined him and he was told he had varicose veins and needs a laser ablation. And I examined him and I said, clinically you don't seem to have varicose veins, but if you come to Hyderabad, I'll probably scan you and confirm. So he came to Hyderabad, I did a Doppler scan for him, he had no varicose veins, and I asked him to meet a neurologist. He met me a few years later. He had undergone laser ablation in Vizag, and he said, "Doctor, I underwent laser ablation, my pain is still not gone." Now, why would the pain go? Because he never had varicose veins. He came to me almost 15 years later, and exactly what you described. He now has a large ulcer on the leg, pigmentation on the leg, which were never there earlier, which would have never happened because he has undergone different types of ablative procedures 5 times on the same leg.
My God. So as you said, there are centers where you walk in with the leg and your laser procedure is off.
So this particular patient, I know for myself that he did not have varicose veins, and yet he had 5 procedures. It's a bit shocking. Now, of course, there is a group of patients who are obese and who have reflux and who have varicose veins. How would you manage these patients?
Well, these patients should be offered both. One is a lifestyle modification where first and foremost there should be a focus on weight reduction.
Correct.
Once you reduce the weight, the venous pressure decreases, and obviously when there is a diseased vein, a varicose veins, reversal of flow against its routine flow, that should be treated. They should be offered intervention, but they should be on a track of losing weight. They should not be on a thinking that once you have operated, the surgery is done, now they are happy and the problem is solved. No, because there are 2 reasons here. Both should be corrected, and they should be we can say encouraged enough and motivated enough to be on track of weight loss.
Correct. So if the symptoms are very severe, operate, weight loss. If symptoms are not very severe, start using compression, weight loss, and then go in for intervention. Simply because when we operate on patients who are obese, one of the risk factors remains, and that will increase the chances of recurrence. And this is in fact documented in literature. Patients who are obese and undergo venous ablation have a much higher recurrence of varicose veins.
Yes.
And for us, we have a very good department of endocrinology, and where we are able to offer patients help with weight reduction and also provide them guidance on diet and exercise.
Yes.
Any final message for people who have varicose veins or who think they have varicose veins?
So if you think you have varicose veins or you have been diagnosed by someone with varicose veins, take a second opinion, confirm that it's varicose veins, get treated if required.
The final thing I would like to say is some of my patients don't want a procedure. Can I offer something to them? Yes. So if they are motivated enough to wear compression stockings lifelong, or as long as they don't undergo an intervention, throughout the day, sitting, walking, standing, I think it's a reasonably good option, and many of these patients can be managed with good compression. However, if you're not able to use compression the way the doctor prescribes, then it might be a good idea to undergo intervention if you have really varicose veins which are symptomatic. Thank you.